The question is, what's missing? So Destiny had a lipoblastoma, which is a very, very rare, benign tumor in childhood that grows very rapidly. Let's bring in Destiny and see if we can help her.
Absolutely. Would you mind sending in Destiny?
Hello.
Destiny.
Nice to meet you, Destiny. Dr. Nassif.
How are you? Terry Dubrow, pleasure.
Maria.
Well, welcome.
Thank you.
I have a lot of your old medical records. It was called a lipoblastoma, yes?
Yes, that's what they called it. At first, like around 3 months, it was just like a pimple on her right heel. Several months later, I noticed it grew to the size of a marble.
And what did they tell you about it?
It was a benign tumor. It was just fatty cells.
Okay.
And they would have to remove it, and there was going to be a big gap.
And so pretty much the best way that it can heal is taking off a piece of her back and putting it on her foot, on her heel.
And it worked.
It worked.
So when I had my first surgery, and there's only 6 other people who have a lipoblastoma, and they wrote a case on mine.
Okay.
Medical journal. The medical journal.
So you're in the medical journal.
Yeah.
Wow. The surgery that Destiny had at 13 months of age was a very intricate microvascular transfer of tissue from her back to her foot. Even an adult, that's a really complicated operation. Imagine how complicated and intricate it is in a 13-month-old, where the nerves, the arteries and vessels are a fraction the size of adult vessels. Some really impressive surgical feats right there. If we are to debulk this, if we don't want to come back, although this is a high-risk case because the potential to disrupt the blood supply to Destiny's flap and have the whole thing necrose and die is high, I think I'm really interested in helping her because she's 19, she's got a long way to go, and it's affecting her both functionally and cosmetically.
Walking barefoot at the beach feels like I have freedom, and it feels awesome.
I want you to bring me a bikini, and we're gonna mark the top of the bikini in pre-op. And if you don't have a belly button in there, gotta try to make you one out of some scar. Not easy to do. This is complicated, fixing this. That exact complication that happened to you could happen to us. Dying, infection, the whole thing. Because now I have beaten up, damaged tissue. I have a special consent form that I have patients in your category sign called high risk consent, which says, besides all of those scary forms you just signed, oh, this is a little different. Oh, what do you think?
I'm just nervous now that you're saying it's a high-risk surgery.
Scary stuff, my dear.
It scares me that I may go through this all over again, but there's a risk in any surgery, so it's just having trust in your doctor, and I have lots of faith in Dr. Dubrow and Dr. Nassif. Before my surgery, I had no belly button and ugly scars going across and up my stomach that resembled Frankenstein. But now, thanks to Dr. Dubrow, my stomach is beautiful. He removed 2/3 of the vertical scar, so I'm able to wear high-cut bikinis, and it's not very visible. I'm completely in love with my belly button that Dr. Dubrow created. It's something that I didn't know was possible. Rest in peace, old belly button.
What you do is you grab hands with the kids, and then you go in a circle, and then, you know, we were going too fast, and I was going like this. I ran into the wall.
Oh.
So you hit the wall with your chin?
With my chin first, yes. And then after that, as time went by, it was just deforming.
So we call the deformity peau d'orange, which is an orange peel in French. If you look at the orange, there's like these little bumps and little indentations in it. So with Yasmin's chin, that's what it looks like, and that's because of trauma to the mentalis muscle. That's what causes the irregularities of her chin.
When I was about 14 years old, we found a plastic surgeon. They took out fat from my tummy and reconstructed my chin.
Did it work at all?
I did see a slight difference. It was just a little bit fuller. After the time went by, it just went away.
Yeah, the fat went away.
Yeah.
Especially in an area where there's a lot of movement, and that muscle underneath the chin here, well, it's constantly moving as you speak. Did you have any other procedures?
I did. I had one when I was 25, another fat transfer. And then until again, time passed by, and it just went away again.
So nothing else after that.
No, I have not.
Is it worse now than it was before you had anything done, or is it better now?
I would say it's worse.
Yeah. Yasmin had fat transfer to try to smooth the contour regularities of her chin. The problem with fat transfer is some of the fat will take, some will absorb, and that really predisposes you to more lumps and bumps and more irregularities. They really should have focused on a procedure to try to smooth the skin and the overall contour.
The goal would be to iron this somehow, which means make it smooth. We lift up the tissue, we look at the contour of what we call the chin fat pad. Do we need to put a blanket on top of that deeper fat pad? So what do we put there? Fat? Don't really want to do that, I don't think. I think you've already had enough fat in there. So the thing that I think about is using some cadaver skin. No matter what we do, there is a risk, a decent risk, that I can make that worse. And probably about a good 25, 30%. It's not 5%, it's higher. Do you still want to do this?
Well, at least there's some percentage. There's not a full no. There's some hope. Before my surgery, I was living with a giant on my chin. My chin was lumpy and bumpy, and I would get asked about my chin every time I went out, which made me never want to leave the house. But now, thanks to Dr. Nassif, my chin is smooth. I no longer shy away from the public. Nothing stops me anymore.
So for us to help you,
Okay.
tell us exactly what you want us to do.
You know, to me, it looks like dog doo-doo. I don't know what to say about it other than I just want to look normal.
Lisa had a short scar facelift because the incision only went up a little bit behind her ear. And if you're trying to correct a neck, you have to make those incisions a lot longer so you can redrape and get rid of that extra neck skin. This isn't easy.
I believe it.
We have to redo something that's called a revision deep plane facelift.
Wow.
And we have to go underneath the muscles and try to rearrange things to get things a little bit more smooth.
Before my surgery, my neck was a wreck. Now, thanks to Dr. Nassif, I am turning necks and causing some wrecks, and I love it.
The question is, what's missing? So basically you have some remnant of muscle here. You have nothing right here. It's pure skin graft on bone. You have some remnants of soft tissue here. Another option is to make an incision across your entire abdominal wall, extending into the unaffected right side. It'll have a better shot at matching the left side.
Right.
The advantage of that is you probably don't love this little extra lax tissue.
No.
It's a tummy tuck on a guy.
Okay.
Big downside is complications. I mean, there's a big difference between working on this smaller area, although substantial area, than lifting everything up, doing a full tummy tuck. But I'm willing to go after it if you're willing to go after it. If you want to do the whole thing,
Yeah.
I'm there for you. I'll do the whole thing.
I think the best option sounds like, you know, even though it's a bigger risk, probably do the whole thing and try to make it look as symmetric as we can.
Before my surgery, there was a big gaping hole in my side. But now, thanks to Dr. Dubrow, the hole is gone. I have symmetry, and I'm no longer in pain when my work belt rubs against my side or anything. There's no way you could possibly tell what my side looked like before. I'm back to dating again, and it just feels amazing.